Friends, from the Kokilaben Ambani Hospital in the Department of Urology on the second floor at Andheri, West in Mumbai. I'm Dr. Sanjay, consultant urologist at this hospital for the last 15 years. Men with graceful aging who progressively and slowly change in their life may sometimes not know that there are changes which are happening, which can actually be curtailed, treated, and cured, but it's slow and progressive change. Two important aspects that happens to men in their 40s and 50s, which then thereafter progresses and catapults to levels from which changes may sometimes not be reversible, are on one side on the urinary issues and other side on the sexual issues. So men sometimes are shy about discussing about their susu and sex, but don't forget, this is something which is inevitable. Men go through this problem. Urinary issues in men progressively change even if there has been nothing wrong happening in terms of trauma, injury, infections, because a male gland called the prostate undergoes a very progressive change from late 40s, 50s, and thereafter into 60s, 70s, and 80s. Prostate, a male gland, which is at the bladder neck from where the urine exits, controls the urinary passage called the urethra. So the entire aspect of bladder contracting and the passage opening is controlled by this very narrow passage, which the prostate can actually take care of by encompassing around the urinary pipe, which is obviously narrow that you and I know about the 18 to 20 centimeter of the organ called the urethra. Urethra is housed within the male organ called the penis, and somewhere gradually as age changes around, changes happen both in the urinary passage as well as the sexual passage. Let's take off men in their 40s on the urinary side. Late 40s, 50s, we know that our urinary flow gradually goes down. The flow is not as forceful as it was in that childhood where we could actually pass with a speed which was forceful, which could in one go with a bell-shaped curve go and completely paint on the wall. The force gradually goes down, the straining pattern comes in, the stream becomes thinner, we sometimes don't empty our bladder completely. This doesn't happen in 40s, but it can happen in 40s too to young men. But it starts in 40s very slowly and progressively and changes from 40s to 50s. And thereafter, it's all about a cascade of change, very progressive. So prostate as a hormone-related gland undergoes a change, which is measured by a sonologist in terms of the size of the prostate. That's what can be measured by an observer-oriented investigation in a static scan. But dynamically, what does prostate do? It encompasses the urethra, which loosens up, opens, and closes with the activity of alpha receptors, which are receptors that help in the closure mechanism and the opening mechanism. So changes are happening there is all that we know. And we very gradually would know that somebody will have a progressive change late, which is our fathers and grandfathers age group. But necessarily it starts at our age group in 40s, 50s and goes on to become bigger and then progressive and then worsens in 70s, 80s around. So in 40s, 50s, what started in 70s, 80s culminates into almost complete obstruction with a poor flow, straining, pushing, not emptying the bladder, sometimes passing in drops and sometimes requiring an emergency catheterization kind of thing around. So are we not going to look into what happens to us in the younger age group so as to prevent something? Because it's all about health checkups, all about preventions around. So if somebody in this audience today complains of obstruction to the flow of urine, any age group, even in 20s, 30s, even in 50s, 60s, or 80s. It is important to see your urologist in your city because a urologist is capable and interested in safeguarding your urinary health. He can pick things up earlier than you can pick up. How? He picks up by doing a test called the ECG of the bladder. In one word, a uroflowmetry. He asks you questions across this table and asks you about how is the urinary flow, what happens to your day and night, are you comfortable enough emptying your bladder, your ultrasound report which you have got, which shows the prostate enlarging and the bladder not emptying, and the bladder was getting thickened because of excessive work that the bladder has to do across the resistance of a progressively enlarging prostate or a small prostate also occluding the urinary passage that thickens the bladder wall. Are you comfortable enough? Are you worsening? And if these questions are answered by you, it is translated into a report. Like the heart's activity is translated into a report called the ECG. The bladder's emptying mechanism is translated into a report called the uroflowmetry. Passing urine in a computerized toilet, where when you pass urine in your full bladder, showing your best flow, the report card which comes over about the examination that you passed or failed It's called uroflowmetry. It shows a bell-shaped graph and then some drops of urine form passing, which is called a post-void dribble, and perhaps your bladder empties to near completion. Compared to somebody else who has a straining pattern, passes slowly, takes a long time with a prolonged flow, and still doesn't empty the bladder. So ultrasound is different. Ultrasound is a more static kind of an evaluation, which in your full bladder and empty bladder, a sonologist has examined, put marks, put measurements, and given to you. But we are more interested in your performance through the same organ, which is gracefully aging, and that graceful aging could bring about changes completely. Very important for us to take this subject forward. So in 50s, 60s, and 70s, the progressive flow goes down only because the prostate causes an occlusion to the urinary passage. So that's one direction of change where a hormone-related change causing an internal growth of the prostate could lead to occlusion internally in the central part of the prostate where the urethra is passing around. So urinary flow gradually goes down. You don't pass urine so well as you were doing around. Changes do happen progressively and you complain. When you complain, it's already the end of the road. In other words, the progression is significant compared to somebody who walks into our clinic at the Kokilaben Hospital on the second floor Department of Urology and tells me I did a health checkup. I've been sent to you for enlarged prostate. I've been sent to you for very thick bladder walls. I've been sent to you for both the kidneys are swollen and the urinary bladder is still full. Or my creatinine is rising in the background of this. Or somebody says, I've got bleeding in urine intermittently for the last few weeks or few months, partly because I take blood thinners of my cardiac reason, or I'm too constipated and strained to pass motions in urine. So people present in many ways, but may perhaps also not complain of urinary issues. Out there, the prostatic size is just not an important aspect. The quality of life that you're leading with changes happening in urinary passage progressively is picked up by us. You had no major complaints. You did a health checkup and the pickup was done by evaluating, discussing, talking, and taking the journey through in walking the talk of your urinary flow. So the flow is a very important test and something which we need to remember that. There are people who present late. There are people who present late in terms of a very enlarged prostate, a lot of obstruction. But remember, men sometimes, because of this very slow progressive change, can handle it very gradually and would continue to look into this aspect of a slow progressive change, a chalta hai attitude where we are taking some medicines given by our doctors, and those medicines are not very effective. You stop the medicine for a few days when you were on a trip, travel, anniversary, or somewhere in a meeting, and you have difficulty in flow. So if you are taking a medicine which should treat you and cure you to a point in time that we could de-escalate the medicines, you're taking it for a long time. You're taking this alpha blocker medicine for your prostate for a long time, and the results are not coming. The flow is gradually going down. The progression or worsening of urinary complaints is happening. Then is there a reason to continue the medicine or a reason for you to see your urologist who could revisit the subject, understand what is the missing link and why is the medicine not working? Are we missing a diagnosis completely? So friends, those who are on medications for prostate and find the urinary flow is not improving, not getting better, and also the evaluation of the ultrasound and the uroflowmetries are not looking very forceful, perhaps you have to see your urologist in time. That's what an awareness is all about. An awareness is about prevention of complications which are progressively happening, which we're not aware of. If you're not aware and changes happen beyond a point in time, we will miss it out completely. So friends, that's an important aspect to take care of. And I always look forward to that awareness goes down to every man who listen to it. All men who are gracefully aging in the 40s, 50s and beyond need to know that prostate will undergo take one direction for sure. In any and everybody, none will escape it. It just depends on what age do you present, how much of ignorance, how much of knowledge, and how much of adjustment that we can do in the background of urinary system, which is obviously changing. And that's something. So a small prostate could even block the urinary passage, and a very large prostate may still not block the urinary passage. So size of prostate may not have so much of meaning as much as your complaints or the obstruction to the flow as measured by various parameters of ultrasound, uroflowmetry, IPSS symptom score that we sometimes do to score your symptoms and understand whether you are a mild or moderate or a severe symptom activity across the prostate. So friends, this is extremely important for men to know, and men miss out completely. There is a small subset of individuals which also is progressively rising, where a hormone-related change could actually turn cancerous. And these people could develop cancer prostate. Something which I continue to see all 7 days a week, where men come, we examine, do a digital rectal examination, and find something extremely abnormal. This could be in a situation where an individual doesn't know anything, and is being evaluated for lower urinary tract complaints, or somebody would come with a very high PSA level or a borderline PSA level, or somebody could just present with a cancer prostate evaluation of transsacral ultrasound biopsy, PSMA PET scan, and say, this is the localized prostate cancer, Dr. Pandey. How do we take it forward? So the entire aspect of therapy to cure is a lot related to your evaluation, which has to be periodical in your age group beyond 40s, 50s. I mean, if you have complained in your 40s to 50s, the changes happening progressively much earlier. But what I continue to see is men in their 50s and 60s sometimes refuse that there's not major trouble. But when we actually evaluate and see the report card, which is how good a student you are, which means uroflowmetry, and then cross question and ask questions around, and then look at the other parameters of the ultrasound, the PSA levels, we get to know that there are changes happening which we are not aware of, or in the busy schedules of life that we live in Mumbai and we lead across the country. At that prime of life, many a times we miss out that important aspect. So friends, if there's a urinary flow complaint, पेशाब खुल के नहीं आता है, रुक रुक के आता है, जोर लगाना पड़ता है, पूरा खाली नहीं होता है, और पता चलता है कि हम दिन और रात बहुत बार जा रहे हैं. बहुत बार लोग प्रेजेंट करते हैं जहां यूरिनरी अर्जेंसी, फ्रीक्वेंसी और यूरिनरी इनकॉन्टिनेंस शुरू हो गई है, कंट्रोल ही नहीं कर पा रहे, भागना पड़ रहा है, अब गाड़ी रोक के यूरिन पास करने जाना पड़ता है. पर ऐसा पहले नहीं था. ये पिछले 3 महीने 6 महीने से शुरू हुई है, जहां पुरुषों की ब्लैडर ओवर एक्टिव दिख रही है, और वो उस एज ग्रुप में है 50s to 70s 80s में. मतलब प्रेजेंटेशन कुछ और चल रहा था, हमने अनदेखा किया, और ये ब्लैडर अब एक्सेसिवली कॉन्ट्रैक्ट कर रही है बिकॉज रास्ता बहुत बंद हो रहा है. तो एक तो डी नोवो ओवर एक्टिव ब्लैडर हो सकता है पुरुषों में जैसे औरतों में होता है, उम्र के साथ भी ये बढ़ सकता है, और दूसरा रुकावट के कारण ब्लैडर एक्सेसिवली कॉन्ट्रैक्ट कर रही है. तो जानना बहुत जरूरी है कि यूरिनरी एस्पेक्ट की ट्रीटमेंट को बहुत तरीकों से डॉक्टर देखते हैं. यूरोलॉजिस्ट का काम है वो 360 डिग्री बिल्कुल देख लें कि ऐसा कुछ मिस तो नहीं हो रहा है मरीजों में. सो ऑन वन साइड एवरी लाइफ मैटर्स, ऑन द साइड टू इंप्रूव द क्वालिटी ऑफ लाइफ ऑफ इंडिविजुअल्स who on this screen come over and listen to the kind of attempts that we make on awareness from the Kokilaben Ambani Hospital in Mumbai over the last 15 years. Attempt is to wake you up. Wake up and probably bring your entire health to the front row seat, more so as a male, a urinary or a urological health. So there is treatment available for prostatic enlargement. There's treatment available for obstruction. There's a treatment available for cancer prostate. ये depend करता हमने कब पकड़ा. एज ए यूरोलॉजिस्ट पिछले 24-25 सालों में हमने ये देखा है कि मरीज जब भी आते हैं हमारे पास ट्रीटमेंट अवेलेबल है. वो बहुत हद तक बेनिफिशियल ट्रीटमेंट होता है, बहुत बार क्योर होता है, बहुत बार पैलिएशन होता है, और बहुत बार लाइफ एक्सटेंडिंग, मॉडिफाइंग और लाइफ चेंजिंग थेरेपी होती है. तो इससे जरूरी है कि वी सी आवर यूरोलॉजिस्ट इन आवर सिटीज वेयर एवर वी आर इन. दिस अवेयरनेस इज on behalf of all urology colleagues who practice the same. They do it as graceful and as good. We need to look into helping you out as you age with grace. Now, when we look into this, I said men also have sexual problems, which actually changes from 40s, 50s and on. Men complain of low sexual drive. Men complain of failing early morning erections. Men complain of absent rigidity in the erections, or they lose erections much earlier than it was in the past. Or many a times they are premature ejaculation. So large picture of failing erections. Apart from organ changes where the organ is shrinking and turning shorter, where the organ undergoes a bend during erection and something which called as Peyronie's disease, for which people do come in seeing us from various parts of the city and country to take the andrology health to a different level. So andrology is all about men's sexual health in terms of their fertility, in terms of their sexuality, in terms of the changing patterns in sexual health. And something as an andrologist, we talk to them, we examine them, we look at their parameters, we enthuse them to get better, because that improves their morale. Confidence building approach on treating them, getting their erections capable enough is important. Sadly, friends who have got spinal diseases, who have got brain diseases, patients who have got injuries or accidents in the region of the pelvis or the spinal cord, patients who have got diabetes mellitus for long standing, patients who have diabetes which are uncontrolled, and sadly, those who are smokers, who are into tobacco, can have erectile dysfunction, which can be very progressive, which can be a very downhill course. And many a times it may not be amenable to the common therapies that we do in terms of hormonal therapy, in terms of PDE5 inhibitors around. And these patients could actually be refractory erectile dysfunction. They could have actually crossed the bridge where medications won't work, all kinds of vacuum erection devices, injectable therapies don't work. And there's a large subset of individuals, patients who are diabetes for a very long time. There is an end organ change happening in various organs, like the diabetic retinopathy eyes, the diabetic cystopathy in the bladder, where the bladder is weakening because of long-standing diabetes, with the sensations going down. Diabetic nephropathy, where the kidney functions gradually go down even if you maintain your diabetes. Very good for a very long time. So changes in long-standing diabetes in the end organs, especially the penis, the eyes, the kidneys, could bring about almost near complete change. Many diabetics for long standing lose erections completely. They have no early morning erections. They're not capable enough. And they seek us for the reason of cure, where penile processes brings about a cure. Penile processes is an implant which we implant into the penile corporal bodies, which actually would get a good erection with the blood flow which was good in that era or with non-disease states. But spinal disease states where the end organ blood supply is changed, like in smoking and diabetes, and pelvic vascular diseases, like in cerebral and brain disease and spinal diseases and trauma. The very blood supply, the neurological issues have dramatically changed, and men don't get erection anymore. If that is what is happening to a subset of individuals, they are into refractory erectile dysfunction. I do speak a lot because we do a lot. We probably help individuals in getting their ways back in life, being confident enough, capable enough to be able to perform around and take it to the next level completely. So refractory erectile dysfunction in men could be as early as 40s, 50s, or could be in 60s, 70s, which have been happening for the factors I just discussed. Again, treatable completely. So aging with grace in men with urinary issues, aging with grace in men with sexual issues are completely treatable. As a urologist, as a uroandrologist, as a reconstructive urologist, looking at various treatments of penile lengthening, of circumcision, of corporoplasties in Peyronie's disease, looking at erectile dysfunction therapies, where we do penile processes. We look at all those aspects from youngsters to middle age to elderly and look at helping them out on the external genitalia, the confidence of which is gradually missing in many of these patients. Friends, this was an attempt to probably enthuse a lot of people who are sitting on the sidelines, who know that their functions are not capable enough. The urinary flow is poor, continue to take medications around, living with stricture on the edge, living with prostate occlusion on the edge, medications not working, not attempting to see doctors, still doing a health checkup and waiting for the health checkup to probably come good, maybe sometimes irreversible. It's time to bring urological health and sexual health to the front row seat for all men in their 40s, 50s, and in 60s, 70s. Important that we don't let it progress to a point in time where when we hope for a change, the change does not come back. Thank you so much from the Kokilaben Dhirubhai Ambani Hospital in Mumbai in the second floor.